why lose it? Even if somebody, let's say they go to the VA, some people might still, correct me if I'm wrong, they're going to the VA for most or even all of their care. They also have TRICARE, and then they got a decision to make. So pretty much, this goes back to what we've talked about before. The only reason they would be able to not take Medicare at that point is it still the same reason? They have to have employer-sponsored health coverage. Right?
Exactly.
So in that situation, it's even more important that people understand I will lose my TRICARE if I don't take Medicare, even if I'm going to the VA for everything. That doesn't count as creditable coverage. It doesn't satisfy Medicare's requirement for the health portion. So I need to enroll to maintain my TRICARE and keep that as a backup because, goodness, I might need it down the road. And so if price is the issue, can you speak to any solutions or ways that, we've been able to see veterans and their spouses get help with some of that pricing?
That is a great question. It's a great question. And so we mentioned it a little earlier, alluded to it a little earlier in another episode, but there's similar programs. They're federally regulated programs that are designed for veterans, their spouses that have VA or TRICARE or CHAMPVA benefits that can actually reduce that actual Part B premium that they'd pay.
And this depends on where they live. Going back to that same point earlier,
Exactly.
Where do you live? What's available in your area? It could be totally different across the country.
It's going to provide them with all the same rights, benefits, and guarantees of Medicare. That's I would say the most fundamentally important part is that they do not lose any of the benefits that Medicare provides. These programs are required via their federal contract to cover everything that Medicare covers, which is hugely important. And they still are able to maintain that TRICARE for life as their secondary or the gap coverage, if you will, that will fill the gaps of that particular program.
And that's contrary to what a lot of the people out there are saying, especially in some of the veteran communities. Maybe it's somebody that were at the VA and they're hearing things that are, hey, if you do that, if you enroll in something like that, you're going to lose your TRICARE, you can't get it back, all these type of things. Am I right? I mean, is there any truth to that?
As far as them losing the TRICARE, no, there's no truth to that. They will not. The requirement to have TRICARE for life is that you have to be enrolled in A and B. That's it.
So what you're saying is you have to be enrolled in A and B, but how you choose to optimize or customize your A and B coverage, that's up to you. And that doesn't change the fact that you still have A and B, right? And so the way I look at it, when I think about Medicare A and B, is I think about it just an off-the-shelf, one-size-fits-all type of healthcare solution administered to the federal government. And we know that there's, after helping so many thousands and thousands of people and seeing so many different unique situations based on, again, geography, where do they live, what are their needs, what's their healthcare situation right now, what is their health situation, do they travel, what's their budget? There's so many factors that go into that a one-shoe-fits-all-feet approach doesn't work, right? It might happen to work for some people, right, where it works really, really well. And we've seen that, right, where we talk to some people and they got Medicare A and B, they got TRICARE for life, and it's like that's what is going to work optimally for them. More sure, and we can help them confidently understand why. But conversely, there's other people where that's not going to be optimal.
Right.
There's opportunity for them to customize that and really pick all, aftermarket, if you will, right? Customize their healthcare solution now through a private insurance company that may get them more resources, benefits, money back in their pocket based on their unique situation.
Exactly.
Right? And we've seen that work very, very, very well for thousands of people, right? But then there's also a whole number of people that it wasn't going to be the right solution, and we're able to show them why.
Exactly.
And there's a lot of nuance to that.